Hello, my name is Megha, and I'm staying here in Greens Ayurveda retreat place for some time. And here with me is Dr. Megha and Dr. Shilpa, and decided, and they agreed to have a few words with me about Ayurveda. Can you say a little bit what is this about, and what is the difference between this medicine and academical medicine from the Western world?
So Ayurveda, as you know, is the ancient medical science which originated in India, and we can see that the uniqueness of Ayurveda lies in the fact that we consider the human body as a whole, and holistic treatment is given emphasis. Along with that, preventive aspects are also given very much of importance in Ayurveda. So we can say that you need not always have to have a disease to come to Ayurveda. You can also be a healthy individual and still choose Ayurveda to make your journey or your health journey much more better and prevent any future diseases. So most of the lifestyle disorders that we see nowadays, they arise because you don't take care of your health. You don't consider your
Yes.
health beforehand, and by the time you go to a medical science, it's too late to reverse the damages. So Ayurveda offers you so many simple solutions in the form of daily regimens, seasonal regimens, and so many tips that you can incorporate in your daily life to prevent future diseases as well. So I find that's one of the most unique aspects of Ayurveda.
So it's more about preventing the illnesses and curing person as a whole, and so in a very holistic way, not just like usually it happen in the other kind of medicine. Is just curing the or decreasing the symptoms,
Yeah.
mostly with the pharmaceutical help.
Here
And
we basically treat the people as a whole, as Dr. Megha said. So we'll be assessing their doshas, their prakriti, their strength, and also their bowel habits, their food habits, and everything. After assessing all these things, we come to a conclusion about what happens, what makes the disease, or what are the causes. How we call it nidana in Ayurveda. So this we'll find out what is the nidana, and we give medicines or herbs for curbing down these symptoms, which will indirectly also affect the nidana. So we'll try to remove out this nidana. As a result, the symptoms also decreases, and the person also will start to have very less symptoms, and also the disease will also be decreased. So we basically have three doshas: Vata, Pitta, and Kapha, and these are considered as the fundamental units that make up a human body, and also that are the reason for the various functions that happen in our body. Each individual, as Dr. Shilpa mentioned, each individual is born with a prakriti. That is a unique dosha combination. Even though all of us have all the three doshas, we have it in different combinations. So that combination is what makes us different. And as she said, the finding out of that particular prakriti and giving you a cure that is in sync with your prakriti is what helps in preventing diseases. So we need to understand and analyze, observe a person, ask them various questions that can tell us their prakriti, and when we give them herbs and lifestyle modification advices, as we do here at Greens, and also treatments that cater to their doshas, that gives them their health back, and this can be retained for a long time and can also help prevent diseases as well.
so this means that for each person is different treatment for the same disease. Let's
Yes,
say.
after assessing the prakriti, we will come to know which dosha is aggravated in that person. So we can give them medicines and treatments also, and some kind of lifestyle modifications like
Yes.
yoga, pranayama, which is breathing exercises, which will help down to bring this aggravated doshas. And as a result, it will bring us an equilibrium of doshas, or we call it samadosha, which is the main motive of Ayurveda.
Yeah.
The main thing that we have to understand is we have to get all these doshas into equilibrium, so the person does not have any disease and he's perfectly healthy.
So this is the base for the whole treatment, to make the three doshas in balance.
Could you speak a little bit more about what was your experience and what your perspectives as a Western individual is on Ayurveda is?
Yes, I didn't know nearly anything about Ayurveda 2 years ago, and this science, medical science, was advised to me by one of the professors in Poland due to my problems related with the complication after some operation in my country. So I decided to come here, and I like it very much because I find it huge difference between our system, medical system, not only system but the way of patient approaching in the Western world and here. Here is much more holistic, and as you say, it's you treat patient as a whole body, and in the Western world is more like treating the symptoms, not curing the patient. So it's very much related to the procedure, unfortunately, and to the backup with the pharmaceutical treatment. And sometimes it relates me in my mind to the situation in old time in China, when the doctors which had some patients, he was paid by this patient when they were in the good health. When they started to get sick, they didn't get paid. So of course these doctors were very well motivated to keep people in the good health. However, like in the Western, when it's completely opposite, people come to the doctor, they become the patient and they get sick. And also here I like the concept of preventing and keeping people healthy. Here I meet many people like me, but not like me, but many people who are healthy, but they are here to keep the good condition, to prevent getting sick. And if something wrong happened, they look deep inside what is the problem, and you of course try to help us to understand that. And I like very much the link between the doctors and the patients, that you don't only treat us as a case. We are not the case, we are human beings. And very often in Western world, we don't feel like that. We feel more like a case. But I think that these things can be combined.
So we wouldn't use any Western medicine for the treatments, but we would definitely make use of the medical advances or technological advances. For example, like the radiologies, different type of radiologies and all, we can help or take the help of these kind of technological advances and utilize that in our diagnosis, or in order to go deeper into a disease or a particular condition. And I think, it, like I was saying, it doesn't have to be a competition. We can all coexist peacefully when our aim is to give the best to a person or to the community or to the country, and the whole aim is to bring back health and well-being to the society. I think we shouldn't be competing as to who's the best. Rather, we should be trying to say what can we do in order to contribute towards the health of the society. So I think we can coexist peacefully when we take the good out of all the systems and implement it in the right way possible.
Yeah, thank you very much, and I treat it as a conclusion, very, very positive conclusion of our short talk. And I'm very happy to be here and meet you, and thank you very much for your time.
Welcome.